Okay, so we're just going to have a look at some of the hazards and interactions, okay, of lasers. Right. Good. So what the outline is photobiology, the laser tissue interactions, eye hazards, and what to do in an emergency, and skin hazards. These are the things that we're involved with as medical physicists, okay? So with respect to photobiology, the nature and severity of the injury depends on how the laser radiation interacts with the tissue, okay? So, we have absorption and scattering properties of tissue, okay? The location and level of absorption in the tissue, especially with ocular tissue, which is your eye, right, is highly dependent on the wavelength, because different tissue will absorb different wavelengths, okay? And then, of course, your absorption depth, how deep your wavelength is going to penetrate into tissue. And so that is what generally governs your photobiology, okay? So here's an example. So if you look, for example, with melanin, this is a response. So down here is our wavelengths. This is in micrometers. So this is typically your light range here. And here is the absorption, how much absorption is taking place. And so you can see what I meant. So when you have different material, they will have a spectrum of whether they let light through or not. I like to give an analogy again with this one, which is like there's a whole bunch of students coming out of class and they're going to go to parties in the evening. And there is 3 discos available, and each disco has different music, One will be, for example, heavy metal, one will be reggae, and one will be general pop. And what you'll find is that there's some who will go to the heavy metal club and they will immediately not enter because they just can't stand heavy metal and they go away. And this is your reflection. And so they just don't go in. And then you get the fans who love heavy metal, they go into it and they stay inside of it. So they're completely absorbed. And then you get the people who don't mind metal so much because they really like pop. And so they will walk in through the entrance door of your heavy metal club and they will walk through, they'll have a little dance and then they'll leave at the other side and go on to get to their normal club. And that's transmission. And that's typically what happens. And I always see it as a means of vibrations, because everything in nature is about vibrations. And it's interesting. So just to give you an example, I think it's on YouTube, there is a professor from MIT who does a talk about why photons do not go through metals. And what he'll tell you is because of the crystal arrangement of the material. Now, when the photon impacts the surface, the vibrational state is up and down and not longitudinal, and therefore it is reflected. And when it's longitudinal, it will continue through the material. And interestingly, a lot of people don't understand that photons are basically pieces of energy, and it's basically how the universe transmits energy in many ways. It's basically the greatest carrier of energy are photons. And when a photon enters a material, whether it's glass, water, whatever, it becomes what we call a phonon, which is basically a sound wave. So it goes from being what we'd call typically a light wave and becomes a sound wave, because it's basically a very high intense acoustic shock that travels through the material. And so you can see that it's a vibration. And so if that material cannot vibrate at that rate, it will not have it. It will just not have it. And if it loves to vibrate at that rate, it will just absorb it. It will just become a part of the background. And there is the part where it can allow it through, but it won't absorb it, and it will just continue on its way. And that's basically how most tissue will interact with the different wavelengths, as you can see. So, here's just rough examples of your protein, your visible, your hemoglobin, which is your basically in your blood. your melanin, which is formations within your skin. Look at water. Water has a whole host of different absorption and transmissions, yeah? And all these things are relevant when we're going to create a laser, because when we look at the tissue that we're going to target, we want to know if it's going to absorb it, because most times when we're using lasers, we want it to be absorbed, yeah? And to take in that particular energy to do the work that we want, you know? So, for example, looking here is it's not a really good picture, but what we have is a green thing passing through one balloon and into another. So it can pop the balloon inside the other balloon. And that's amazing that the light can pass through without damaging that balloon. But with this balloon that absorbs it, it will damage it. And that's just a typical example, you know? And so it's a 585 nanometer wavelength which passes through the outer balloon, but is strongly absorbed by the inner red balloon, which explodes. We need to do another one of this and have it much more clear. Probably do a video, which would probably be a good thing. And so that's how photobiology kind of works. So if we're going to go and treat tissue below the skin, we want wavelengths that are going to go through the upper part of your dermis without interacting with it too much, because we don't want to burn a hole through. And then we want to get into those lower tissues where we can do the job that we need to do, you know? So there's a lot of skin complaints that get dealt with by lasers. For example, there's psoriasis, there's red port wine, and so on. And these things are things that will live on your skin. Lots of skin conditions lives on your skin, and your body is like happy to live with it because it doesn't really know there's a problem. But we use the lasers and damage the skin. And when we damage the skin, the body then says, oh, I am damaged. I need to sort this out. And what it then does is it comes along and it repairs it. So it's actually not the laser doing the repair, it's your body. But what we need to do is to tell your body it needs to repair itself. And that's typically the whole idea behind photobiology and the things that we do. We also can use lasers to trigger drugs. So you might have a drug that goes in your system. It will go to various areas where light can get through, and it's then triggered by using a laser. We can use a laser then to trigger it back. So we can use that in things like cancer treatments. We know what cancer cells love to consume, which is sugar. They love sugar. And so what we will do is we'll target with different molecules, which will be poisonous to the cell, but they won't interact with any cell till they get to the area. So we'll wait until the cancer cell eats up this very special sugar that we gave it, and then we will turn on the light. And then once it's in the area, we turn on the light, and the drug becomes activated and kill all the surrounding cells, which hopefully and technically will be the cancer cells. So that's another example of using the whole idea of absorption for particular cells and so on. So with our tissue interactions, once we absorb the optical radiation, the energy can be dissipated in two ways: thermal energy, which is heat, or a chemical reaction, so ionization or bond breaking. Okay, so basically we're doing a bit of destruction. So three types of interactions can be distinguished. We have photothermal, photochemical, and thermomechanical. And the interactions also depend on the wavelength, exposure duration, and the amount of tissue, or the tissue which is exposed, the skin or the eye. There's also other factors, for example, because your scattering comes into play. And so we might need to either increase the beam, the width of the beam, or the power in the beam, and so on. But these are typically your main interactions that occurs when it comes to tissue. And you can see here, we have the thermomechanical, which is up here. This is a power density scale. Here's your regular thermal, and down here's your photochemical. Okay, and these are your exposure times. So your photothermal effect, most common effect, right? So it's leading to an increase of temperature of the tissue, right? Injury occurs instantly. So you can see the temperatures involved here: tissue hypothermia, edema, your protein denaturing, denaturing, tissue necrosis, water and tissue boils, so you get tissue hydration, and of course, greater than that leads to carbonization and melting. So it depends on the effect that we want to have, okay? So while we're talking about injury, we have to remember that we're doing this injury on purpose. We're doing it because we want to do this, because we might be wanting to destroy particular tissue, okay? And I'll take a little time here to explain something. We often ask the staff and the people involved with treatments of patients, what do they think patients are coming into the hospital for? And then I will ask you here, if you thought about it, why do you go to a hospital? And if you were to ask a patient, what is it you expect when you go to a hospital? And their typical answers will be, I'm going there to be cured. I'm going there to be healed, and so on. And I'm going there to be treated nicely and to come out feeling good and working properly. And I always find that interesting, the view of what hospitals are. But in actual fact, when you think about a hospital and what we do, and this is something that you may not have considered, when you go into a hospital, these are the things that will get done to you. Let's give you examples of what hospitals do. You have surgeons. And if ever one watched a film that would have, for example, a serial killer running amok, and they would show him with his tools, the tools that they will typically show you a serial killer will have are the tools of a orthopedic surgeon. So he has some of the most gruesome looking tools. They're saws, they're hammers, they're all manner of stuff, because he's going to work on your bone, and he will need tools like that. And then the other thing is, when you come in, they'll say, "Oh, what's going to happen?" So you'll have the surgeon who's going to cut you. He's going to open you up. He's going to explore around inside your body, and then he's going to sew you up. And then another thing they'll do to you is that they will poison you. And how the poison works is that every medicine that is dispensed is a poison. And the reason why it's a poison is that it's going to go in and it's going to do a job. It's either going to destroy something that is causing problem in your body, or it's going to change the way your body works. And so in many ways, that's regarded as a poison. And so you're going to be poisoned, okay? And then what else will they do to you? I mean, if you even think of physiotherapy, the way they manipulate you and bend you and twist you up, it's really painful during procedures like that. But at the end of the day, it's all for your own good. So in actual fact, a hospital doesn't really cure you. What it does is that it does some form of injury to you. And then they will say to you when you're being discharged, "We'll see you in 6 weeks." And they send you home. And so that 6-week period is a typical average time that your body will repair itself. And that's the whole point, is that with respect to all the treatments that we can do for you, it's all about getting your body to heal itself. Whether sometimes we remove things from your body because they don't belong. But again, at the end of the day, your body is going to have to heal itself. And so that 6 weeks period is typical healing time, unless, of course, it's like a broken bone, which will probably take a bit longer and so on. And so looking at the effects that lasers are doing, you can see that's what we're doing. We're going to boil tissue because we want to destroy it. We want to get rid of it, yeah, because it's causing a problem in your body. And so these are the things that we look at when we're using a laser. That's what lasers are. It's a tool for doing some kind of destruction, yeah? And then there's a photochemical. So it competes with the photothermal. So at particular irradiance, right, it's not high enough to do the thermal damage, but it's certainly going to cause a change. So UV energies are enough to cause ionization and create free radicals. You can have cumulative effect where short exposure of high irradiance and long exposure of low irradiance lead to the same damage. And injury and damage occurs after a period of time, several hours. So the damages observed will be skin burns, skin cancer, cataracts coming from being like, for example, being in the sun too much. It can cause skin cancer and so on. So if one was going to have laser treatment, the number one thing they will tell you is, they will ask you is, have you been on holiday recently? Because if you've been on holiday, they won't treat you. They will tell you to come back in a couple of months, because the sun does damage to the skin, believe it or not. And we may not notice it, but it has done it. If you then go on to add laser damage to it, you can trigger skin burns, cancers, and cataracts in a horrible way. So that's why we don't treat patients who've been exposed, and typically because of these effects. And of course, you're thermomechanical, and the term here is your mechanical. So you heat it up very rapidly and locally. There's a thermal expansion, okay, and it induces mechanical shock waves, okay, and these propagates in the tissue, causing more damage to the surrounding tissue. And so we can do ablation. It leads to ablation, where you can take off layers. So you can get ultrasonic pulses 10 to the minus 12 picoseconds, as they have high peak irradiance and electric field strength, and can lead to optical breakdown of the material. And again, so we're taking advantage of the physical effects of what laser light can do, and depending on the wavelengths as well, to create the kind of damage that we want for your body, in order to produce the effect that we want to produce, to start the healing process, and to get rid of whatever it is that is causing a problem. So particular hazards, okay? So here's your eye hazard. This is your typical eye, the pupil going in, and then here's the back of your eye, okay? And again, it depends on the wavelength. And here, down here, you can see the effects of those wavelengths. So you have your retinal hazard region, which is here. So that's the entire visible range, stretching into the near infrared. And that's why I was saying earlier, it's from 400 nanometers to 1400s. So these lasers, just imagine you're using these lasers. You can't see them, so you don't know that laser is on. But that's going to the back of your eye, and it can create problems for you. And that is at the back of your eye, where if you get a spot, like a burn spot, and we've had accidents in the past, in the early days of lasers, where it's burnt the back of the eye, and it just can't be repaired. Somebody got burnt because they didn't wear their eyewear. So eyewear is very important. So that's part of my job as a laser protection advisor, is I look at what wavelength it is and the power concern. And then we use tables that are available in British standards and other places. There is international standards as well, the ISO standards, and they give the tables, and we do the calculations as to what strength of protection the eye should have. And really, it's much more difficult to protect your skin. It's just that we just say, don't go burning your skin, but at least your skin can heal. But with your eye, once you lose the vision, that's it. So we're very particular about safety with respect to staff. We're going to work in a laser environment. And on this side here, where it's a UV, the main hazards, as well as your far infrared, is going to be at the front of the eye. So this sort of stuff will create cataracts. So this is something that is notable again. People who live at high elevations are more exposed to UV because there's less atmosphere, less thickness of atmosphere, okay, on the planet. So what you will generally get is that people who live at those heights will be more prone to having cataracts, mainly because of the UV. And so this you can see is expressed. But now that we've reached the point now where we can literally take lenses out and put new lenses back in. So part of the procedure in your eye is that they bore a 1 millimeter hole in the surface of the eye, and they go in and pull your natural lens out, which has become cloudy, and stick a plastic one in, which is depending on the agreement you had regarding what kind of vision you want, whether it's near, mid, or far, and they can stick it, and that can be done really quickly now. So medicine really has moved on. It's incredible. So that is the eye hazards coming, and this is a range. And hopefully you'll have the PDF so you can always refer back to this. So with the UVC, so it's absorbed by the surface, which is what we were saying, right? And high-powered lasers can cause ablation of the cornea. Example, the excimer laser. That's 308 nanometers, right? And so if the peak power is not high enough to cause ablation, it can cause inflammation, which will develop after several hours. And so the one place that we use eximers a lot is in cardiology. So, and it's fiber. We enter the patient in their groin area, go up the vein, up towards the heart, and then there may be things that is causing blockages in the heart. We can use that laser to just burn in an ablative way all the stuff that is causing a blockage. And that's really brilliant because those particles are not big enough to go on to go cause things like strokes. You know, strokes are normally caused because something has accumulated and it will go somewhere and block a vessel somewhere in the brain. And then there is a lack of blood flow, which then causes a reduction in oxygen really quickly and leads to the stroke. So ablative lasers are very good like that because it's just taking away that issue and then the body will naturally just gets rid of it. So if the peak power is not high enough to cause ablation, then it will cause inflammation, which will develop after several hours. And so typically, that's what the effect of UV is. Then UVB, which is absorbed by the cornea and the lens. So for accidental laser exposure, the exposure level will be exceeding the threshold and can cause permanent damage to the lens. In which case, what you're looking at is new lens, which I just described, that we can replace the lens now. So that's not too bad. Note with the UVC, the 100 to 280 nanometers, this is the UV that you'll use to do disinfection, like you will clean surfaces, because this thing will kill bacteria. At that wavelength, you're killing bacteria and various other little things that are creeping around on your work surfaces and so on. But you have to wear eyewear with this, otherwise it will cause the blindness. And not to say that the rest don't, but this is particularly nasty. UVC is particularly nasty. And so and then later on, I think when you do your ultrasound, and I think there might be a UV thing course, they will go into these in more detail. And so, and then you have your UVA. It's absorbed by the lens again. Photon energy is not high enough to cause photochemical damage, but it can induce thermal damage. So basically, all your surface effects are here and not at the back of your eye. So for visible and near infrared, C is the most dangerous part of the spectrum for your eye injury, because once it gets to the back of your eye and it does damage, well, that's it. There's no repairing that. And so this is the wavelengths that will be transmitted through this material that gets to the back of your eye. Yeah, and so it goes back to what we were talking about before, how different material can absorb different wavelengths and the way they allow them to be either transmitted or reflected and so on. And so for our eye, this is the wavelengths that we have to be very careful about, especially with your lasers. So you know if you're going to be in a room or anybody's going to be in a room, they should be wearing the relevant eyewear to protect their eye. Okay, and so that's where we get all worried. And so it's a 1 milliwatt per centimeter squared entering the eye would be effectively increased to 100 watts per centimeter square. And the reason for that is your eye is a focusing unit. You know, it's a lens and it's going to focus things to a point. And that's how you're able to see wonderful images, because light that is being reflected from everything goes in all manner of direction and your eye is capturing it. And another good example of this is when you're using telescopes to look at the stars. The larger the mirror, the more light that you will capture from that single point of light, that star that is in a distance. And so you get a better image. And so this is what it is. Your lens is collecting the light, and then it's going to focus it to a point where it becomes something that your brain can make sense of, if you like. Yeah. And now your mid and far infrared. This again is these are surface effects. These wavelengths don't generally go deep, right? It's absorbed by the cornea here, and this one is the aqueous humor, which is your transmission liquidy looking thing in your eye. So, and it's caused mainly thermal damage, heating of tears and tissue, right? Flash burns, corneal burns, infrared induced cataracts. So pain triggers the aversion response, which may help to limit the tissue damage because it's happening at the front of the eye. But generally, you don't get pains at the back of the eye. It's not really something that I've heard a lot of people experience. Some people do because there's too much light. It's highly intense, and basically your brain is saying, "Oh, that's too much." But these are things that we must keep in mind. So again, this is something that we would protect against. It doesn't matter. I have a rule. In fact, what we'll come on, I think we'll come on to it in the next one, but there is this thing called the NOHD, which is the nominal ocular hazard distance. Basically, what it means is if I have a laser and I'm going to point it at you, how far away from the laser have you got to be safe? That the beam will spread enough that when it enters into your eye, it's not a problem. Well, that's a pretty long way. And in some cases, some of the lasers that we have, it's only 20 centimeters. Okay, it's not even a foot long. And so what I do, I have a rule. I don't care. As the laser protection advisor, when we're designing theaters and the rules that I put in place, the local rules, I will tell them, I am sorry, anybody in this room have to wear glasses because once you close the doors to do your laser work, I consider it a dangerous room, and I want you wearing your glasses. I don't care how far or how near that beam is. I want you with your glasses on because I know what it's like when you get hit with a laser. Even if you're far away and the light goes off, it can be so intense and bright that you may temporarily be blinded. If you're holding something which is dangerous in your hand, you could cause an accident or have self-injury. So it's my rule to make sure everybody's wearing glasses. And so here's some typical examples. Here, look, you can see severe cataract in this eye here in the bottom left, okay? Right? And you can see all of the redness. Look, that's photokeratitis. I can never say these words, right? Which is comes from UV exposure. And then look, here's a boy was playing with a green laser, bought off the internet, right? And you can see that's a 532 nanometer, obviously, and that's it's look, partial vision loss. And this is how it heals after a little while. Doesn't look much better, does it? There is going to be a dark spot in his vision, okay? And that's typically what it is. That's another thing I like to point out when I'm talking. When you're on holiday, there's always these little laser trinkets on sale in the market. They're typically keychains, and it has a nice little button where you can press it and you get these beautiful little red lights. I don't like them. The reason why those things have appeared on the market stored and they're readily available, for the public, is because they've failed their classification. And generally in a factory, when they've failed to be within the range that they were aiming for, it means because they failed, they put them out the back door. And so they're sold as a bundled thing in the back door. And all the warnings on them, we have tested them and we found that they're wrong. So they may say, oh, this is class 1. No, it ain't. It's not a class 1. Or it's a class 3R. No, it's not. It's a little bit too powerful to be the class 3R. And so my advice to people always is when you get those things from the markets, you don't purchase them. If you do purchase them, the one thing you do not allow is a child to play with it. Because children have the habit that if they have anything that emits light, the one thing they're going to do is to shine it in each other's eyes. And it's a given that they're going to do that. And so that can cause injury. And so this is one of the advice I give. We do not play with stuff like that. And so here's another example of eye injury. So a 21-year-old looked into the exit aperture of an infrared yak. Now, that's just like pointing a gun at your head and pulling the trigger to see if it has a bullet in it. And this is why I hate. So, one of the things in my talk always when I'm doing the safety talks is you do not look in the aperture, all right? Or you do not look down the handpiece to see if you can see anything, because it might be the last time that eye sees anything. And so it's quite important not to do that, and because you can see examples of the injury. This is what it is. Uh, this is the 4 days after the accident, and this is 1 month after the accident. And so basically, if you ever come across an eye injury, the first person you take them to is an ophthalmologist. Eye doctors are really clued up on when it comes to lasers with the eye, and they're the only people that you should really go to first. I mean, of course, you go to your A&E department, but really you want to be seen by an eye doctor because they're going to be able to examine damage and make the proper assessment of what is wrong. Right? Dazzle. So this is the other thing. Now, your laser may not be dangerous for your eye in terms of causing a burn or anything like that. But the other effect that it can do is a dazzle. And so there's new laws here, for example, in the UK, where if you point a laser at a helicopter or an aircraft, you're going to prison. And the reason is dazzle is an amazing thing. Dazzle can cause after effect images in your eye. It's similar to like when you're driving at night, it's probably raining, and the headlights from these new cars, which use LED headlamps, are very dazzling. And so it reduces your vision. And if you were to look up suddenly and that guy didn't turn down his beam and had it on high beam, you would certainly be affected by it. There's a temporary blindness, and there is the after effect where your eyes recovering from that sudden piercing light entering in your eye. And so this is another effect from your eye injury from this kind of light. And so we guard against this by explaining to the users inside the theater that even though the laser may not be dangerous, there will certainly be the dazzle effect. And if you're working on a patient and you were to be flashed, then the last thing we'd want you doing is holding some dangerous implement in your hand and not being able to see what's happening. And so that's certainly an effect that we are aware of. You can see why I insist that once people are in the room, everybody's wearing their PPE, right, which is your personal protection, because you cannot afford to have accidents, okay? Not with lasers anyway. So skin injury is a little bit different. It's quite secondary to eye injury, okay, because they typically will heal, though in some cases it can leave scarring, and that's something that we have to pay attention to. So when laser doctors are going to do skin treatments, for example, they may not start your treatment straight away. What they'll do is they'll do a test batch, and they'll tell you to come back again in your usual 6 weeks period. And the reason is they need to see how your skin heals. And so there is 5 tones of skin, okay? It's a range going from dark to light. And it's amazing that you can get 2 people that have the same lightness, and yet their body will react to that same energy and wavelength completely different. So you cannot say every human being that comes along that looks like the other human being is going to be treated the same way. No, it just doesn't work that way, because we have subtle differences in us, each of us. We're kind of unique, all of us. And so that's why they do test spots. They do a test spot on your skin to see how it's going to heal, see if there's going to be any scarring. Nobody knows how each of us is made up 100%. And so this is why they'll do it. But you can see here, these are your different depths that your wavelength will go. So here, this is your surface. You can see your excimer doesn't go in. This is your UV. It doesn't go deep, okay? There's typically your CO2 will just go a little bit deeper here. but it doesn't go all the way in. So this can ablate this layer quite comfortably, whereas that will only take off a super fine layer, probably just your first surface skin, okay? This is your erbium YAG. So that's 2,940 nanometers. That goes a little bit down in here. So again, the erbium, the CO2, all of these lasers here are fondly used by dermatologists because the dermatologist is always interested in your skin and he's looking to treat what might be wrong. And you can see some of them just goes and it stays in the epidermis. This is the PDL. This is a dye laser. Okay. This is a KTP. So this is a 532 nanometer laser. And this is these. I like these lasers because they generally have two wavelengths. They have a 1064 and a 532. And what it is it's a crystal with another crystal behind it. So when it produces, they produce a laser light of 1064 and two 1064 photons will go into the other crystal and mix and join their energy by pushing that electrons up higher and produce a 532 nanometer photon, which is quite clever, I think. I wonder whoever came up with that, or they may have discovered it by accident. And then, of course, the ruby goes quite low down in your skin. See, you can see, well, deep. But we no longer use rubies as such. I think rubies are taken out now because of the type of treatments, we have much better lasers that are available. For your example, your alexandrite, your 755, your diode going deep in, and your ND-YAG going deeper, you see? And so all of these are used. And of course, the effect on the skin is all dependent on these factors: your wavelength, your power, your spot size, exposure duration, your blood circulation, heat conduction of exposed skin. So as said, the skin injury is secondary to your eye and it will heal, okay? But what we don't want is scarring, okay? So here's your injuries. You have burn, thermal injury, and for example, sunburn, photochemically induced injury, okay? So UV can lead to skin reddening, also called erythema, high radiance, short exposure, and low irradiance. Long exposure produces the same effect. And you're visible. High radiance or high radiance exposure cause thermal damage and may affect skin pigmentation. That's another thing that can happen with your skin. It might affect your pigment. And then there's infrared. Near infrared can penetrate deep into tissue, causing serious injury. So far infrared laser, example, your CO2 absorbing the surface layer of the skin, but can cause carbonization. And we would use a CO2 to basically cut through the skin, because when you bring it down to a point, it becomes industrial. That's what it becomes, in my opinion, and it's able to just cut straight in. So very good for cutting things like keloids off the back of your head and your neck and areas like that. And as well, remember what I was saying, it cauterizes as it goes, so it seals the skin. So you can see some burns here. This is from hair removal, and you can see where the treatment protocol was not followed, right? And that's the scarring that is left behind, okay? So obviously, that's a problem because a lot of beauty clinics are offering hair removal, and oftentimes they'll get these kind of problems and then wind up coming back to us in the hospital. And so what we would have suggested they do is to do a test spot, because if they'd done a test spot, they would have known this person is prone to scarring for these wavelengths, and really should just leave well alone and look for a different method. And you can see here again, this was hair removal used on a tan leg. So no, do not go into the sun and then get treatment, because you can see here there's a loss of pigment in the skin, okay? And so laser beam can cut through your finger of the staff. Look, he was doing alignment, you can see that. So you don't mess around with lasers. They can cause serious injury, okay? Now, so these are examples of skin injuries, This will not heal readily. I'm not quite sure at what stage this injury is being shown, but that will not heal readily. However, I will say, for example, we have an incorporated children hospital, the Evelina Hospital, and I remember once a child was going to get treated for port wine stains on its skin, and it was really horrible. It was all over the body. It was this red tissue where the body has just been living with it, and so it was going to go in and get full treatment. And I don't think the plastic surgeon had completely explained to the parents what the child was going to look like when it came out. So I did say to them, "Yeah, I say your child is going to come out looking as if it's been in the worst fight of its life. It's going to be totally black and blue over. But I guarantee you that in 6 weeks, you'll be back to ask the doctor to do more." And so when the child came out, I could see the shock on their faces. But they were cushioned because I had explained it. And then they went, and I saw them again in 6 weeks, because that particular laser was a kind of tricky laser. So I was always in attendance with it to make sure. And I saw them come back and they said, you're right. We do, we are back for more. And I was just like, yeah, I told you. So it's amazing. So immediately after treatment, the skin will look really bruised and terrible. Like I said to you, when you come to the hospital, that's what we're going to do to you. And so, but once the body is healed, it gets rid of whatever was causing the problem, and the skin returns to normal, which is really good. Yeah. So, in summary, you have all these various eye injuries caused by these different wavelengths, and you can see them. So for us, the visible and the near infrared are very damaging for us, and so we want to avoid these basically. And basically, we do that by wearing the correct PPE. With the rest, we know it's going to be surface, and if you're near a very good eye hospital, they can probably give you a new lens, which will correct that. But best avoided, if in my opinion, yeah, rather than to suffer the injury. But remember, between these wavelengths, you don't mess around, because that's a one-time hit, and a one-time hit is enough to lose your eye. Okay, and so for emergency procedures, which is what we always say, you must get a full ophthalmic examination. I think I spelled that wrong. Must be undertaken as soon as possible, and in any case within 24 hours. What a good thing to do is to fill in what happened, uh, explain it, where it happened. Other settings, you must record the energy, the pulse duration, the wavelength, and so on. Because the more information your ophthalmic surgeon has, the more he's going to be able to help you. And of course, typically, if there's a injury, you have to secure the equipment as well. You contact all your laser safety person, head of the clinical laser specialists, and of course, you got your exam. All right, and typically, if you follow the path of lasers within medical physics, you'll probably wind up being a laser safety officer, or a laser protection advisor, or a laser protection supervisor, one of those things. Then you really have to be versed with what your emergency procedures are, and how best to respond to incidents, because that is you. If by responding, you're going to certainly help. But remember, your help is going to be more from a scientific perspective. And it's good to take the notes down, because you need to know what happened, so that in any local rules that you produce for the department on another time, it's going to cover the possibility in your risk assessment of that happening. So you want to iron it out, and work towards having a risk-free environment, if you like. It will never be completely risk-free, because they are using a dangerous instrument, but you're going to reduce the risk as much as you can. Okay, and that's the end of that one. Any questions?
So much.
Are we all asleep now?
No, you're here, definitely. Thank you so much, Dr. Paul, for that insightful session. It was really a lot to learn. I mean, from how the lasers interact with various tissues in our body, to understanding that those little key rings that we all used to buy like as a toy,
That's
it's
right.
actually not very
Not
good for
safe.
health.
Yes.
Thank you so, so much. Thank you so much. And I mean, understanding as physicists the different effects of lasers is also something to pay attention to. So we
Yes.
understand that like there are different effects, the photochemical, the photothermal, and the
That's
thermochemical
right.
effects. Thank you so much. There are a few questions, but just before we go to the questions, we are going to do a short poll just to get everybody involved once again. So I'm going to be launching the poll and it's just going to be for a few seconds. So do
That's
well to
fine.
respond to the poll. Let's see how far you have learned today. And yes, it's going to be an attendance for the conference. So please ensure you participate in the poll as this is going to determine your attendance for day one. Thank you very much. So that is it launched. Everybody, let's try to participate. Let's try to participate. Okay. Let's keep it going. We have 19% participated now. Let's keep it going. Keep it going.
Maybe you should share the QR code so that no one is left behind.
Yes. Can everyone see my screen, please?
Okay, we can see now. Yeah.
So I've just shared the QR code. If you're not able to see the questions, just scan the QR code and you'll be able to do that. So the first question is about football fans shining lasers on the footballers.
Oh,
Does
yes.
does that have negative effects for the footballers? And also when you go to
Yeah.
parties and there are after parties that they use laser lights.
Yes. So yes, this has been an issue. So it's nightclubs. Nightclubs are problematic because you get your beautiful green and red and blue lasers shining up and down inside of the club. What we look at is the beam spread. So they're generally lines or they're conical, shapes going out, and is with respect to the distance. So if your lasers are in the ceiling and they're shining down on your audience, and your audience are at a certain maximum height, say, so you choose the highest person you think that can come into that club is probably going to be just under 7 feet, is going to be your highest person. Then that distance with respect to your cone, you can calculate out and work out if it's going to be dangerous at that point. So, not sure if I followed this in the next talk, but to explain, there are particular values that we hold precious in lasers, and that is the size of your pupil. So the average size of a pupil, we consider it to be 7 millimeters in regular ambient light. Okay, and that is the size of the pupil. So that's the size that's going to take it in. However, in a darkened room, your pupil will open. That means it's going to take in more light. So your susceptibility for the amount of energy going in is now greater. Okay? Even though the room is darker, but it becomes a bigger problem. So if a laser was to hit you when your pupil is nice and closed because you're in bright light, it's less damage than if your pupil is open in a dark space, because most of the light is going to go in. And so they now have laser protection advisors in the UK who are now geared just to look at those events. So they go along, they see how the event is going to work, they look at the energy with respect to those lasers for those events, and then they calculate out what the risks are. And if there's a risk that is going to exceed what we call the MPE, which is a maximum permissible exposure for your retina for that wavelength. And every wavelength has a different value. And so there's tables that shows the ranges for the different wavelengths. So they look at if it's going to exceed that value for anybody there's a risk of that, then they can say to them, there's a risk. And if there's going to be a risk, they can literally tell them, no, you can't use it. And so the laws are working to change these things. With respect to handheld lasers at football fields, that's just illegal. That's just wrong, and it's down to the governing bodies of those matches to make sure that they isolate those individuals and get rid of them because they're just there to cause problems. And I can see why they're going to do it. It's going to be the fan of one team trying to upset the footballers of the other team so that they will fail in seeing the ball when like balls are being passed and so on in order to give their team an advantage. But that is absolutely wrong. And while there may not be a specific law saying you've shone a laser light, you've got to look at the fact that they have done something which is wrong. So there's other methods in the law that they can use against those individuals, But certainly with the football governing body for the stadium for that particular day, they should be able to act and send the stewards in and kick them out of grounds because that's unacceptable behavior, and definitely could cause injury. So you're putting somebody else at risk. So yes, shining any kind of lasers at events is an acute problem. Yeah. And, that's what I was saying to you earlier that if you, in this country now, if you shine any lasers at any aircraft, you're in serious problems. So one of the things that protesters do is they will shine green lasers at police helicopters who's monitoring the crowd. What they don't know is that these police helicopters have equipment in it that can isolate a laser to within 2 meters, even in a building, even if it's somebody's standing in a flat somewhere, in a group of apartments, and they shine a laser at these helicopters, they can isolate it to what point and to which apartment that laser beam came from, because the equipment is in there sensitive enough to work out direction and angles, heights, and everything else. And generally, what happens to them is that the police turns up at their door and they're really surprised and they go in and say, "Where's your laser?" And they don't only take the laser, they take the individual as well because he's going to court the next day. And so the rules governing lasers is getting tighter, certainly in the UK. I don't know about the rest of the market. I mean, I can go into the web right now and I can buy myself a 20 and 30 watt laser. And why would I want to do that? Not unless I'm going to be doing some kind of physics experiment. I have lasers that I use in experiment, but I use them in very controlled environments. And I certainly wouldn't want to go and buy something off eBay or Amazon or wherever and then think that I'm going to use this in my experiment. It says 30 watts and I'm going to trust it. Yeah. And imagine as an individual who hasn't got the training or the equipment to measure those lasers, they're going to make mistakes. And they're probably not going to even have the correct eyewear for those lasers. And again, they're running risk against themselves. One of the biggest problems with lasers is reflection. So, if you have any shiny surfaces, mirrors or anything, you can't have those in theaters. You can't have them in the room that you're going to use lasers with. You're going to get rid of them because once they bounce off that, they will come right back onto you and cause a burn. So yes, those issues are a risk. Any other question?
Thank you so much, Dr. Paul, for that answer. I hope we all understood that. So before I go to the other questions from the chat, Dr. Ibusa has a question and I'll allow her to ask the question quickly.
Okay, thank you very much. And apologies to those who are asking questions. I just wanted us to connect it with what is going on back here. Dr. Paul, you're in the UK, you're a laser specialist, and you have all these laws. And what about in Nigeria and other African countries where we don't have this kind of specialists? What can we do in the interim as physicists? For example, you were talking about lasers being used in tattoo parlors, in beauty clinics, for hair removals. These are very common procedures that are done now by a lot of young people. So I'm just concerned that, these tattoo parlors, are there people who are checking the safety of these equipment, the QC, QA and all this, I'm just really concerned about safety of all these things. And the toys we're talking about that children play with, for example, we don't have laws. These things are in the market. I see them everywhere. And we don't have police like in the UK who is going to arrest these people because they don't even know about this thing. So what would you advise us as physicists? What can we do in the interim while we are thinking, of course, long term to get people to go into this area of specialization, but what can we do now in the interim as Africans who do not have these policies and
Okay.
specialization?
So I know this is something that has to be worked on and developed. Yeah, it's also I was talking with another fellow from Jamaica, and they're trying to get their act together as well. So there is a document, and you can make notes on this because globally you can get access to it. The organization in the UK is called the MHRA. And if you get onto their organization, it's a web page. You can just search on the web. They're the medicines people who look at equipment to check them to make, and they record all the incidents and everything. It's called the MHRA. And if you get onto their website, they do a book, a PDF, which covers all things lasers. It's incredible. It's a great awareness, how to create the local rules, how to do the risk assessments, talks about all the necessary issues surrounding lasers and light. Yeah. And I think that's a good document to start from. Yeah. I will always recommend this document. I should have it here. Let's see. If I sent it to you, Ayo, will everybody get it?
Sure.
Yes, please.
Yeah. Okay. So I'll send it to Ayo Abasa, and she can pass it on to all those who are on the list. Yeah, definitely. I think that's a great document, and it covers so much, and it's a good start, even for those who have the clinics and stuff. Now, generally, when you have people with private clinics, what they do, there is certainly a supplier of the laser, and the supplier normally has a application specialist. That is a clinician or somebody who is very familiar with doing the procedures that they're going to use the laser for, that can train them. Okay? And sometimes the people selling you the laser, the salesmen themselves are the application specialists sometimes, not always, but And so I think that is their first reference point, is to go back to the company selling them the item, unless they're buying it secondhand, which is where it becomes a gray area. But typically they can look up who will be an application specialist with respect to that laser for procedures in beauty clinics, And at a minimum, they can go on the web and look at AI is wonderful now. You can do fantastic searches on procedures using a particular laser, if you get what I'm saying. And that will come back with a lot of feedback. Not to say you should be trusted 100%, because AI doesn't get it right 100% of the times, but that is also a good starting point. And until an effective medical physics service is developed that can also offer its services to private organizations, because they can rent your service, because we do that. We look after private clinics. So, you might have heard of famous Harley Street clinics in England, in London. Well, we look after a few of them. So we will go along and ensure that their laser safety is correct. As a physicist, you're not responsible for dictating, and I always make this point, clinical procedures. You're not a doctor, okay? So you can advise on how the laser work, what is the technology behind the laser, what it may do to skin or eye, but you're certainly not there to tell them how to treat, because you have to remember, and I like to point this over, our doctors today, our modern doctors, are equivalent to our ancient shaman. Okay? He's our modern medicine man. And that means he has a power that you don't have. So if a doctor gets something wrong and something goes wrong with a patient and he's taken to court, he can say, I did my best for the patient, but it didn't work out. And he will walk. However, if you're the one advising and say, oh, this is what you should do, doctor, and you've gone and told him that, and something goes wrong with the patient, it's quite likely you're going to jail because you're not a doctor. And so you should never have given clinical advice, okay? Because that's not your remit. You're a scientist or an engineer. And so what you have to remember is your remit is confined to that. So you can explain the way the equipment work. You can explain the dangers behind it. You can say, well, this is likely to be the effects it will have, but you do not tell them this is what you should do. Am I clear on this? Did I get that across?
Yes,
Yes,
thank you.
sir.
Excellent.
Yeah.